everybody. My name's Donna Sporandio and I work as Head of Rehabilitation at Medill. Our presentation today is about rehabilitation for the population of adults and adolescents who receive cochlear implants. This is what we're going to look at. First of all, we'll look at the adolescent population and some key considerations to think about with them. Then we'll follow that with some suggested rehabilitation strategies for that age group. Then we'll look at adults and older adults and look at some key considerations for that population. And then again we'll look at some rehabilitation strategies for them. So let's start by looking and thinking about the adolescent population. In the group of children who come to us to receive cochlear implants as adolescents, there are really two key groups. One is those who've had a sudden hearing loss. So that might be due to a trauma or due to disease perhaps. So that's one group that we typically see coming in for cochlear implantation. The other group are those that have had a long-standing and progressive hearing loss that's perhaps progressed to the point where hearing aids no longer are doing a good enough job for the adolescent, and so they present as a cochlear implant candidate. For those with sudden hearing loss, we need to recognise what is happening for them. So they're really dealing with either an illness or an accident that's been quite recent often. And they're also dealing with a new diagnosis of hearing loss. That group often has an established language system. So it might be that the auditory training process for them is shorter because they already have that established language and listening system to build on. The population of those with a long-standing progressive hearing loss are a little bit different. These adolescents often already have experience with hearing technology, but they may have had some negative experiences of that or of rehabilitation because they've been managing with a poor signal for some time. Sometimes this group has a less established auditory and language system, and so for them sometimes a longer period of auditory training is necessary. Another thing to consider in the adolescent population, we need to remember that language is not fully developed in childhood. So in the adolescent years, language is continuing to develop. That can include things like complex verbal reasoning, the language of persuasion or negotiation, the understanding and use of figurative language, sarcasm, jokes, etc. And in the adolescent years, typically sentences get longer and contain more complex ideas. So we are looking at a population that is still developing language. Adolescents have some concerns at this age. They're really starting to think about acceptance from peers, independence from their parents. Their own self-identity really starts to come to the fore in the adolescent years, and they can also be very concerned with their physical appearance as related to their self-esteem. And these are considerations that we need to think about as we go ahead with a cochlear implant for them. It's been shown in research that children with hearing loss who wear hearing aids or cochlear implants sometimes exhibit less mature social skills than their peers of the same age. That's something we need to be aware of when we see these children. So let's think about some rehabilitation considerations for this population of adolescents. First of all, a very important part of this process is going to be counselling for them, both for the adolescent themselves and of course for the family, for the parents of the adolescent. They're going to need significant encouragement and significant support. This time can be quite a disorienting and emotional period for an adolescent. So somebody who's there to support them and talk through these issues with them is important. Let's think about counselling in the pre-implant time. What should we be talking about? Well, we want to talk about what are the potential outcomes post-implant. We want to talk about the expectations of their visits to the clinic. How often will they need to come? What will they be doing in those visits? Those are important pieces of information that we know, but that we need to ensure that we share with the adolescent and with their family. We need to talk about what might happen when the person receives a new and different signal through their cochlear implant. They need to be prepared. If the person has used hearing aids for some time, they need to be prepared that this signal is going to be different. And for the adolescent population, we know that we're likely to get a better outcome if the adolescent is also involved in the decision making around the process. Then what about counselling post-implant? Well, we want to discuss what are the new sounds that the person's experiencing. What are some of the situations they've found that were easier than they expected? And what are some of the situations that are challenging to them post-implant? The typical kind of things that we hear are the overall amount of noise in the environment. If someone's been struggling with a profound hearing loss for some time, the amount of sound that they hear post-implant can be quite a lot. We often hear that there are struggles in situations of background noise, so we need to talk to the adolescent about how we might manage that. We also often find that, particularly for the population with the long-standing progressive hearing loss, that there's a lot of new high-frequency information coming in through the device. This is information that often, not always, but often has been missing through the use of hearing aids. And so that is new information that the adolescent needs to come to terms with. So what about some rehabilitation strategies? Well, we want to develop the adolescent's sense of advocating for themselves. It's useful to talk openly to the adolescent about their hearing loss. Help them to understand their hearing loss better. What's the level of their loss? What does an audiogram look like and how do we read it? What are the devices that they're using now and perhaps in the past, and how do they work? What is the impacts of their hearing loss? How might it be that that hearing loss is impacting on them? We also want to support adolescents in talking to other people about their hearing loss. We should help them to learn some vocabulary to describe themselves, to describe their form of communication, whatever it might be, and to describe their hearing loss. I sometimes talk about the words hearing using technology. I've found that that can be a useful phrase to describe the situation for our cochlear implant recipients, because they are hearing at the time when they are using their technology. It's just a suggestion. We also want to talk to them about strategies to manage when there is a communication breakdown. And I'm going to talk some more about those types of strategies when we cover the adult population. We need to, for our adolescents, most of them will be involved in educational settings. So we need to encourage both parents and teachers to check for their understanding and communication. If there's a difficulty in following an instruction, we need to check, did they not hear the instruction? And maybe did they not understand the instruction? Because just hearing is not necessarily understanding. So those are important strategies that we need to teach to the parents and teachers who work with the adolescent population. We also want to empower the adolescents themselves to request clarification if they feel that they haven't heard or haven't understood everything correctly. So we want to really help to empower the adolescents themselves to ask for what they need in the educational setting. We can encourage teachers to follow good teaching and learning practices, things such as working from the known to the unknown, starting with easy tasks and moving to more difficult ones, moving from what's familiar for the person to what's less familiar. And particularly with language, we need to encourage our teachers to use familiar language, so what the adolescent is already familiar with, use that language where possible to introduce new concepts. Then typically the adolescent will need some time in a formal auditory training program. And for that, you can often use materials designed either for the children's population or the adults population, depending on the age and maturity level of the recipient. And I'm going to talk some more about the details of that auditory training when we discuss adults. So let's go on to thinking about the population of adults and older adults who receive cochlear implants. Let's look at some key considerations for this population. Again, we're seeing those two key groups in our adult recipients, those who've experienced sudden hearing loss and those who've had a long-standing progressive hearing loss. So similar to what we discussed before in adolescents, they're the two key groups that come to us for cochlear implantation as adults. Similar to our adolescent population, those with sudden hearing loss, they're dealing with either perhaps a recent illness or accident and a recent diagnosis. But again, they've often already got an established language system, so they may need a briefer period of rehabilitation. For the long-standing progressive hearing loss population, again, they will have had experience with technology. For the adult and older adult population, we need to be aware that recent research has shown us that hearing loss is independently associated with accelerated cognitive decline. We don't yet quite know why that is, but we know that hearing loss and cognitive decline are independently associated with each other. So we need to be aware that adults and older adults who come into us to receive cochlear implants are at risk for cognitive decline. We know that there is often delays in identification and assessment of hearing loss in adults. Recent study in the UK showed that the average time between experiencing hearing difficulties and a diagnosis for adults who were in their 70s was 10 years. So that's a long time of that delay between the person's identification of a hearing loss and a confirmation. And other studies in the UK have shown that doctors often fail to refer patients who come to them mentioning hearing loss. In this case, they failed to refer 45% of those reporting hearing loss. So those things together, we know can lead to significant delays in providing appropriate amplification. Those delays then increase our difficulty in managing the hearing loss. Now we may see more comorbidity with cognitive problems because adults have often had a long time without an appropriate diagnosis and without appropriate technology. There's even further risk of cognitive problems. And as people spend longer without appropriate technology and as time passes, we might find as well that their motor skills have deteriorated over time. So let's look at some of the rehabilitation strategies that we might be able to use for adults and older adults. And as I said earlier, a lot of these very appropriate to use with the adolescent population too. So first of all, I think we should celebrate. Cochlear implants have been shown over and over again to have a significant impact on quality of life. We know from research that the main learning and adaptation to cochlear implants happens relatively quickly in the first 3 to 12 months after implantation. So we do want to get started in the rehabilitation process early post-implant. So what are the components that we should see in a rehabilitation program for this population? Firstly, we need to have aspects of counselling. There needs to be a piece of auditory training, really quite formal training in getting to grips with that new signal. We need to think about communication therapy, and for some of our recipients, if there is access, then training in speech production, how somebody expresses sound, can also be useful. But we know that for every recipient is different, and their needs in those different aspects need to be taken into account, so that a good rehabilitation program is highly individualised to the needs of each recipient. So let's look more closely at each of those aspects. First of all, let's think some more about the counselling for adults and older adults. As we mentioned before, aspects of encouragement and support are really important in what can be quite a disorienting and emotional period. It's a very useful part of a rehabilitation process for an adult to have time to tell their story of their hearing loss. Often to tell you about how they came to the process of cochlear implantation, of what their hearing loss has meant for them in their lifetime. Simply listening, encouraging and supporting that information is a really valuable aspect of rehabilitation. Again, in the pre-implant period, we want to be thinking about potential outcomes. What are the potential outcomes that the patient is looking for? What are the outcomes that we think might be possible for the patient? We need to be clear on what our expectations will be of visits to the clinic post-implant. How often is a patient going to have to come in for mapping? How often are you going to ask them to come in for a rehabilitation process? What is it that your program can offer, or what is it that other programs around a patient might be able to offer? And again, lots of talk about expectations of the new and different signal. I like to use the word different to describe the signal that patients will receive from a cochlear implant. I think it's important not to put negative words around it, so not to describe it as to tell people that it might sound awful for a while, or it might be overwhelming. Instead, I think it's more useful to use words like it will be a new signal, or it will be different to what you've experienced before, so that we're not setting up an expectation of something negative. Then post-implant, similar to what we discussed before, talking about the new sounds that have been experienced. What are the things that have been easier? What are the things that have been more challenging? And again, often it's a matter of spending some time and listening to patients and what they have to tell you. It's not necessarily about finding a solution all the time, but just in hearing about how they're going. For adults and older adults, it's really wonderful if you can include family and friends and colleagues in that process. It might be, if they're not able to come in personally, that you can provide some written information to the patient that they can give out to their family or colleagues that helps them to understand the new situation. Many programs include group work in which cochlear implant patients come together and have a chance to chat to each other, to share their experiences, and to perhaps learn some rehabilitation strategies at the same time. So I think it's really useful to consider group work for rehabilitation for the adult population. Let's look a little bit at what we mean by auditory training. So auditory training is a useful part of the rehabilitation process. By this we mean guided listening tasks, and we want to look at two key aspects for our patients: the development of analytic skills and the development of synthetic skills. Let's look at those some more. So by the analytic skills we mean the small level of information. So having patients really learn about and listen to so that they can understand the small pieces, the details of the signal that they're hearing. We might start, for example, with aspects of suprasegmental pieces in speech. By suprasegmental aspects, I mean all those pieces of speech that are not really the vowels and consonants, but the prosody, the intonation, the rhythm, etc. that's involved in speech. That's what we mean by suprasegmental aspects. So we might start simply by having a patient count the number of sounds that they hear, the number of syllables in the words. We might look at aspects of intonation, so information about meaning and emotional tone. How is it that a syllable might sound different with a flat tone, with a falling tone, or with a rising tone? These are aspects of intonation that we want to focus on in this analytic process. Then we'll look more into the segmental aspects. So these are the aspects of consonants and vowels, the actual sounds that we hear in words. In consonants, we want to encourage our patients to discriminate between two consonants and then to work towards recognizing them. We sometimes do that with minimal pair exercises where patients are listening to two pairs of consonants. As with all aspects of rehabilitation, we start from what's the most simple and then we increase in difficulty. We start from a closed set, so a small number of things to listen to and choose from, and then we open that set. That's another way of increasing the difficulty. Here's a little exercise in which a patient is being asked to discriminate between two sounds. These sounds are being presented in rhyming words. This is quite a difficult exercise, so for this patient, this is really towards the more difficult of the segmental aspects of analytic training. Okay, Camilla, this time we're going to do some listening to words, and these words are quite similar. Coat,
coat,
goat,
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 coat.
coat.
Okay, do you want to see if you can hear the difference between them?
Mm-hmm.
Goat.
Goat,
Yeah. Goat.
goat,
Coat.
coat.
Yep, perfect. Good job.
Great, thank you.
So you can see in that example, the two words coat and goat were presented. First of all, expressively, so that the patient had some time to listen, and then she was asked to discriminate between those two sounds, and she was able to do that. As I mentioned, that's quite a difficult exercise in the hierarchy of analytic training. In the aspects of segmental pieces for analytic training, we also would introduce different vowels in a similar way to what you've seen. Initially, we might present the vowel in isolation, and then later we might put it within two consonants. So in isolation, an example would be ah. In the CVC structure, the example might be pub. So you're hearing that in two different ways. It's also important that we vary intonation as we do exercises around the development of listening to vowel sounds. The other types of analytic activities we might use is closed set sentences, patterns of words. So it might be the types of patterns that you hear in different tenses. The stress of words, so in a sentence that's the same, whereas there is a differing stress in that sentence. We might encourage patients to hear the difference between different genders, so between a male speaking and a female, and different age groups. Which one's a child? Which one's an adult? We want to always think about the emotion of the speakers. So a sentence that's presented in a happy tone, or a sentence that's presented in a really angry tone, and encourage our recipients to hear the difference between those. And as you saw there in the exercise in the video, maybe some rhyming alternatives, some fine level listening. We also want to look at synthetic skills, and by synthetic skills we mean tasks that are more natural and closer to real life situations. For this type of instruction, we usually use sentence-level materials or connected discourse, so short stories or songs. So in this way, we've got the bigger picture. We're making use of the fine-level skills that recipients have learned in the analytic tasks of rehabilitation. We might start, for example, with sentence length or pattern recognition. And we can present these activities in an auditory alone fashion, so we're really encouraging listening. If a patient doesn't manage to succeed in an auditory alone condition, we can simply do the exercise again and allow them to watch us at the same time. Here's an example of an activity in which sentences of different length are being presented to a recipient, and then she's asked to discriminate between them. Okay, Camilla, the same thing. I'm going to read the sentence, and then you'll read it. We'll read each of them, and then you'll listen and see if you can tell me which one.
Okay.
And you can either point or you can say it back.
Okay.
Okay? I have one dog.
I have one dog.
Hello.
Hello.
My name is Camilla.
My name is Camilla.
My name is Camilla.
My name is Camilla.
Hello.
Hello.
I have one dog.
I have one dog.
Good. Okay, time to listen. I have one dog.
I have one dog.
Perfect. My name is Camilla.
My name is Camilla.
My name is Camilla.
My name is Camilla.
Hello.
Hello.
Perfect. So again, you can see in that exercise that I read the sentence and then ask the recipient to read the sentence herself. That's a really valuable part of this exercise because it's really important that she learns to listen to herself, to her own production, as well as someone else's. Moving on in difficulty, we might present an exercise around a topic-related sentences. So these are sentences, a list of sentences around the same topic. It might be, for example, the weather, or travel, or family. And this is a bridge between a small set of sentences, such as you saw in the last video, a bridge from there towards more open set listening, because the recipient has a clue as to what the sentence is going to be about. So it's not a completely open set that they're having to listen to. You'll find this a really, really useful way of encouraging recipients to really start to trust their own listening and to work towards listening in an open environment. And again, you can present these sentences either in an auditory visual presentation or auditory alone. Often I start with auditory alone. Then if the patient's struggling, simply take the screen away and let the patient see at the same time. Then you can revert to the auditory alone condition again. Give them another chance just to listen to the message. So in this exercise you'll see us talking about topic-related sentences. Okay, Camilla, this time I'm going to say some sentences that you can't see, but they're going to be about the weather. Okay, so each of the sentences will be something to do with the weather.
Okay.
You ready?
I'm ready.
It's windy outside.
It's windy outside.
Yep, perfect. Did you bring your umbrella? What? Have a look. Did you bring your umbrella?
Did you bring your umbrella?
Perfect. Did you bring your umbrella?
Did you bring your umbrella?
Perfect. So you saw in that example that there was one sentence that was difficult for the recipient, and so I simply dropped the screen and allowed her to see my face at the same time. And that way she achieved success. So then we went back to the listening only condition to help her practice listening in that sentence. Another aspect of synthetic training we call connected discourse. So this is where we're looking at bigger pieces of information, texts, stories, for example. I'm going to show you some examples of tracking paragraphs. This activity you can do at an easy level and work it through to more difficult levels as your recipient progresses in their skills. In this activity, the therapist and the recipient has an identical text. The therapist reads and the client follows. So let me show you first of all what that looks like at a very simple level. In this exercise, the recipient is just asked to follow along and listen. It's important to choose a text that the recipient might be interested in, especially for the adolescent population. If you can find something, it doesn't really matter what it is, something off the internet or something from a book with information around a topic that the recipient's interested in, it can really help them to enjoy the process of rehabilitation. So you'll see in this first video that I'm simply reading the text and tracking along with my finger what I'm reading, and the recipient is simply listening. So this is a very nice way to encourage recipients. Even our very early recipients can manage this task. Okay, Camilla, this time I'm going to read this story, and as I read, I'll point to the word that I'm reading. So you just need to follow along with my finger. There was a swimming pool in the town, and I went there almost every day during the summer. It was about a mile from my house to the pool. That's a lovely activity that you can encourage families to be involved with when recipients leave the clinic. Simply reading something from the newspaper, perhaps, an activity that they can do together, and it's really building listening mileage and listening time for the recipient of their new device. In this video I'm going to show you how to add the next level of difficulty to this task. So in this video the recipient is asked to listen, and then when I stop she's asked to come in with the next word. So this is really encouraging her to follow along very carefully through listening to the text. Okay, this time I'm going to read and you're going to listen, then I'll stop and your job is to say the next word.
Okay.
Okay? We're going to read the same sentences. There was a swimming pool in the
town,
and I went there almost every day during the
summer.
It was about a
mile
from my house to
the
pool. So you can see the same activity but adding in another level of difficulty for the recipient. In this video we're doing the same activity but moving to an even higher level of difficulty. So sentences that the recipient hasn't heard before, and she's asked to listen and to repeat. Again, it's really useful if you can find something of interest to the recipient so that first of all they might be familiar with the vocabulary involved in that text, and it just gives them some more encouragement in the process.
I'd usually walk there,
but sometimes I'd ride my bike. Try again. But sometimes I'd ride my bike. Okay, have a look. But sometimes I'd ride my bike.
but sometimes I ride my bike.
I'd usually walk there,
I'd usually walk there,
but sometimes I'd ride my bike.
but sometimes I ride my bike.
Yep, perfect. So again, you can see that when the recipient struggled a little bit, I asked her to try again, and then when she was still struggling, I simply let her read my face as well, and that helped her to get the correct answer. Then I chose to repeat those sentences again for extra listening practice for her. So we've looked at aspects of counselling, and we've looked at aspects of auditory training. Now I want to look at the aspect of communication therapy. In communication therapy, we want, where it's possible, to spend some time with the recipient of the cochlear implants' significant other people in their lives. That might be their wife or their husband, their flatmates, their main colleagues at work. It can be really useful if we can spend some time with those people, teaching them ways that they can communicate with the cochlear implant recipient, which will be helpful for them. We want to teach them to ensure that their face is clearly visible to our cochlear implant recipients. In their everyday life, it's going to be much easier for them to hear and understand if they can see the faces clearly of those around them. We want to encourage the others to use clear speech. That doesn't mean to over-articulate speech, but it means to speak not too fast and to ensure that enunciation is correct. We also want to talk to the significant others about some repair strategies. So what do they do if the recipient doesn't understand them? We can teach them these strategies. We can teach them to repeat the message. Try saying it again. They might try simplifying the message, so using fewer words or more common words. Or they might simply try rephrasing what they've said to allow the recipient another chance to understand. As part of communication therapy, it can be useful to encourage our recipients to keep a listening journal. And that way they can describe what they hear. They can record their memorable experiences in their journey towards hearing. They can list things that they found were problems and potential solutions. And they can describe their interactions and communications with others. Some recipients really enjoy doing this, and some are not so interested. But for those that do, it can be really useful if they're happy to share that with you when they come in for their appointments. And in that way you can get a sense of how they're doing in their cochlear implant journey and what it is that they're struggling with and what they're finding easy. So keeping a daily listening journal, whether they share it with others or whether they don't, can be something that you can suggest to your recipients. As part of communication therapy, we also want to think about advocacy training for our recipients. We want to help them to develop coping behaviours. How do they manage in those situations that are stressful for them? We want to help them develop strategies to optimise communication with others. And we want them to learn to adapt to some perceptual limitations that still exist. For example, there is likely to still be more difficulty in situations of background noise. So we want to talk to our recipients about how they might manage that. In advocacy training, we talk about 3 different types of strategies to manage this. Firstly, repair strategies. Secondly, what we call corrective strategies, and anticipatory strategies. So let's look at each of those. So as part of advocacy training, we want to teach our recipients how to repair a conversation that falls down. They also need to learn that they might need to repeat a phrase. They might need to rephrase what they've said if it wasn't clear. They might ask others to simplify their messages. They might ask others to repeat or rephrase what they've said. They might ask others to elaborate on what they've said if it hasn't been clear. Or they might perhaps provide a key word or a clue. So, for example, if the conversation is around going to a movie, it might be that we can teach the recipient to say something like, I understand that we're talking about when we will go to the movies, I just didn't hear the time correctly. So in that way, we're teaching our recipients how to manage conversations for themselves, how to advocate for the information that they need. So those are some of the strategies that we can teach to our recipients to repair conversations when they go wrong. We can also teach corrective strategies so that the recipient can advocate for themselves. So if someone they are listening to is behaving inappropriately, then they can mention that. If, for example, the talker is speaking too fast, they might learn some strategies to stop the speaker and ask them politely if they could be a little bit slower in their speech. They can use corrective strategies if the environment is unfavourable. If, for example, in a meeting, many people in a work meeting are talking over the top of each other, it might be that we can encourage our recipients and give them strategies to correct that environment. So to ensure that instead of the situation where people are talking over each other, that each person is identified when they're going to speak at a meeting. So we're really giving them strategies to identify a problem and correct it. That's what we think of as corrective strategies. As another part of advocacy training, we think about anticipatory strategies. So this is where we encourage our recipients to prepare for something that's coming up. They can review potential vocabulary that might be used. What are potential questions that they might want to ask? It might be that they want to rehearse an upcoming interaction. So if, for example, a recipient is going to have a talk with their employer about their salary, they might want to think about what are some of the vocabulary that will be used. What are some questions that they could ask? They might want to practice that situation. So in anticipatory counselling, we're really advocating for our recipients to be well prepared for an upcoming interaction. So just a little bit specifically on our older adults. Some thoughts for you about strategies that you might want to implement for those older adults who come into your program as recipients of cochlear implants. We would suggest for this population that you think about allowing some more time. So they might need more appointments, and they might need some longer time in those appointments. Older adults sometimes will need additional processing time. So they might want to hear a piece of information and be allowed a little bit more time in a calm manner to process that. Or they might need some repetition of what they've heard. We recommend that you give opportunities to that recipient to bring someone else along to the meeting or to their appointments. And that way they have some emotional support and there's someone else there to hear the information. We would encourage you to ensure that background noise is kept to a minimum in those appointments. And that doesn't just mean the background, the noise itself, but we would also hope for no interruptions within the appointments. It can be disconcerting for adults to be interrupted constantly in their conversations. We would encourage less visual clutter where it's possible for appointments. So while it might be useful to have some props for explanation, not too much all over the walls so that the person can focus on what they're hearing. We also encourage you to think about good seating positions, particularly for older adults, so that they're comfortable and able to relax in the situation of their appointment. For this population, again, clear speech is very important. So as professionals working with the older adult population, you need to be able to provide them with clear speech so they have the best chance to understand you. It's also useful to provide written materials where it's needed so that the older adult has a chance to go back and think about what they've heard, read it over again, and perhaps share it with another family member. So the provision of written materials can be really helpful. For those older adults receiving a cochlear implant, we've talked about the risk that cognitive decline has been part of the hearing loss. So in our rehabilitation activities, I would suggest that we can add in some activities that include more of a cognitive aspect. Things like auditory sequencing. For example, I will give you 3 sentences. You try and put them in order. Or here are 3 historical events. Can you tell me which one happened first? It might be auditory chunking. Here are some names. Can you find the match? Obama, Elizabeth, Barack. So the person's encouraged to listen and then match together the names that match. Or it might be that we give a list of words and encourage the person to make a sentence from those words. Or a compound word that we've taken apart and we ask the person to listen and put that word back together. Boy, cow. We put back together as cowboy. Other activities that include additional cognitive load, things like auditory processing. An exercise where perhaps the therapist is thinking of an object and the recipient gets to ask 20 questions to see if they can work out what it is. In that way they're listening, but they're also cognitively processing what they're hearing. Auditory memory activities. Here are 3 film stars. Can you remember them in the order I said them? Then maybe can you remember them backwards? I'll tell you some children's names and ages. Can you tell me which is the oldest child? So these are all activities that build in a cognitive aspect. So the patient's being encouraged to listen, but really exercising those cognitive skills around auditory processing. We also want to ensure for all of our recipients that we build their listening endurance, so that listening for long periods of time can be quite difficult for new cochlear implant recipients. So longer periods in which the recipient is asked to give their attention to listening, building that over time is really useful. And our recipients can practice those skills independently, for example with talking books or practice activities online. So I hope that's been helpful for you to look at and think about these 2 populations, the population of adolescent recipients and the population of adults and older adults. And I hope that you will try some of those rehabilitation activities in your practice. Thank you for your time.